Just shut off the whole system.
Okay, Don, you're good.
Okay, let's call the meeting to order. This agenda was posted in the office of County Clerk on the 7th day of May 2020. Notice was sent to the West Bend Daily News, WIBD, WNBC Radio, WTKM Radio, Express News, My Community Now, Hartford Times Press, the Kawasaki Statesman, and the Milwaukee Journal Sentinel. We'll first entertain a motion to accept the minutes from January 17th, 2020. I hear a motion for from Kathy. I hear a second from Mr. Clark. Any corrections, any discussion on it? Seeing none, let's vote on this. All in favor, signify by saying aye. Aye.
Aye.
Any opposed? Okay, we'll begin with the communicable disease update.
So you in your packet, you have the communicable disease report since, I believe it's since January until the end of April. I'm sorry, the end of March. You're both Washington, Ozaukee County. It does not include coronavirus, which I know is the hot topic and it comes up later in our report or in our meeting, but nothing significant has changed.
The only thing I saw was it an increase in Washington County?
Yes.
D?
Chlamydia, I think.
Yeah.
High, very
So
high.
that was the only thing that I was kind of looking at because we already have 69 cases and there was 79 total last year, and we're not halfway through the year. Anybody
It's more
know?
closely aligned with 2018 and 2019.
Okay.
So I'm not sure what happened last year,
Yeah.
or if that number is accurate. That's a good question. I didn't look closely. I have to be honest, I didn't look that closely at this.
Well, I'm sure you had other things to do.
Maybe.
Yeah.
But we did have internal conversations about it.
Mhm.
We are continuing to follow up with those positive cases. So
Okay.
we have not ceased operations of our other programs despite COVID-19.
Wow, that's pretty impressive.
Yeah.
Been trying.
Yeah.
Kirsten, wanted to see if you could talk a little bit about this Kawasaki disease now. I've read a couple articles about some effect that COVID-19 may be having on children. Very limited cases, but I don't know, is there any connection to that? Are you aware of?
I don't know. They don't know yet. I think at first blush, there was an assumption that that it was related to COVID-19 and it was an inflammatory response, particularly in pediatric cases. It seems I have not heard of any cases in Wisconsin. I know there was a health alert that went out to every pediatric provider in the country and every pediatric hospital. So I think they're now actively looking for those cases, but they seem to be concentrated currently on the East Coast.
Okay, thank you. Okay, any further questions regarding the communicable disease update? All right, seeing none, let's move on to the WIC report, Wic Report.
So the Wic Report we had incorporated in January. I don't know if anyone remembers, but that was the first time we incorporated the Wic Report into our Board of Health reporting. So this is the framework that we decided to put it in, what we thought would be useful for you. Basically just goes through what's been done in the first quarter of 2020. And in terms of WIC, we have been providing WIC services virtually for all of our clients to assure that people have access to food. And we have seen an increased number of requests to be enrolled in WIC since this has all started. We currently have scheduled all virtual visits through June. So we're able to do everything, certify people and get them their benefits through at least June virtually, so we don't have to have anyone coming into the office. But the WIC team's done a great job of planning what this looks like as we move forward in this new environment. But it's one of our key concerns is making sure people have access to food, especially young children and parents. So, but enrollment is going up.
Looks good.
Yeah, they're using it.
Yeah, which is great. So the word is out. And we have been, I don't know if you've been following our social media, but I know we have put posts out there about WIC and access to
Right.
WIC, that it's available. So,
Yep.
yeah.
No, that's good.
And I just have a quick question. I don't, unless I just changed my glasses, and so I've had a hard time getting. Does it say, it says here 950K, April 2020, month of benefits. Is there anywhere that it says how much the program costs us? Because
So
I
it's a
think,
federal program. I mean, we can pull our numbers, how much it costs us to run the program, but all the dollars come from federal WIC allocation that's then given to us.
the only reason I bring it up is I think it would probably look like a very good example of a money well spent.
We get like 300,000 a year.
That's what I said.
You know, if you did a cost analysis and
Right.
said, serving this many people and this is how much it costs, I think it would demonstrate that it's federal funded. That
Right.
would demonstrate what a great deal this is for our
Right.
county.
We spend, just to have the program
Slightly over.
operating, what is it?
Slightly over.
Just over $300,000 a year
Oh.
for the
And so-
staff.
Yeah, and if you look at the number of people that you're serving, that's pretty good.
Yeah, it's great.
Yeah, so somewhere in the next time this is done, I don't know if it's possible, but I always think it's important that people understand when things are a good deal to make sure and point that out.
Okay, we can add something on here on to-date costs
Yeah.
associated,
Right, so it's worth its bucks.
right?
Mhm.
Hey, Kirsten, you may not be the right one to answer the question, but how are the food pantries holding up?
They're actually doing pretty well. They're well stocked. We've been marketing them. I know people have been utilizing them. They're doing it virtually as well. It's actually like a drive through, you drive up and get your food. But they seem to be doing really well. We've been working very closely with them to make sure that they have what they need.
Okay, great, thank you.
And are they still looking for volunteers?
Do you know him?
Some are, but are they scaled? I don't think so.
We don't think so.
I think they scaled down.
They scaled down their operations so that they can operate with the least amount of people.
Okay,
But we can keep you posted. We have one staff person that reaches out to them like at least once a week, don't you? Yeah,
Yeah.
at least once a week, so.
Okay, any other questions regarding the WIC report? All right, seeing none, the COVID-19 situational update, Kirsten.
Like 30 seconds.
Well, so the Supreme Court, as you know, ruled Wednesday night around Safer at Home. We have a total of 131 cases in Washington County and 125 in Ozaki. That was as of last night. We had an additional death last night, so I think we're up to 11 in Ozaki and 4 in Washington County.
There's 2 in Washington County today.
Oh, deaths? Or-
No, the cases.
Okay.
And then
So we were on a steady decline since the beginning, like early April.
Yeah.
And we are now climbing back up. We had the highest day of positive cases on Tuesday, or was it Wednesday? I don't remember, Tuesday or Wednesday. Since this has all started. So we are definitely, we were averaging for most of April, in the beginning of May, 1 to 2 cases a day. And now we're averaging anywhere between 6 and 8, and we had 12 on Tuesday. So it is climbing back up.
Was that due
Is
to
that because of testing though?
No, it's not
Okay.
because of testing.
But-
It's just, I think because people are starting to mix and we're seeing an increased number of cases.
Okay.
Kristen, has the testing improved? Are we getting the supplies and things that we need?
So testing is really complicated. And there are numerous pieces to testing. So first we have our healthcare systems. They have prioritized testing for people who are either in-house, in the hospital, or being ready to have surgery, or if they have a primary care provider within their system, they may or may not get a test from their hospital system, from the system they're affiliated with. So the hospital systems don't have swabs to do broad testing, and they don't have the lab capacity to do broad testing. Then we have what the state is offering, which is swabs from a lab in Madison. They have been offering those to nursing homes and long-term care facilities. They've prioritized nursing homes. To date, none of our nursing homes have done it. I think the state's still working through the process of doing the actual testing. It's not as clear cut. We don't have the capacity to go out and test. We have 9 nursing homes between 2 counties. Each of them have over 200 residents. And then those tests have to be given to the nursing home. All the individuals need to be swabbed. They need to be collected. All the information around those people needs to be collected and needs to be sent to the lab. So it's not as simple as like just running a test. So that's happening. We have a relationship with Aurora that allows us, and we've had this since the beginning. So we have been able to identify people who are associated with a positive case who are symptomatic. We've been able to get them tested quickly within 24 hours, and we get the test results back within the same day, generally speaking. We've had that ongoing, and we have been running like anywhere from 4 to 5 tests a day. And since last Monday, we've ramped that up. We have the capacity to do up to 50 tests a day. But I think the most we've done in one day is 15. So it's not a significant number of increased testing. All of that said, there was a free event in Waukesha last week. Or was it this week? It was early this week. There is free testing available in Milwaukee currently. I don't know enough about it, but it's through the federally qualified health centers. And then we are going to be offering 2 free drive-through testing events on May 28th, 29th, and 30th in Ozaukee County at Concordia. And then May 31st, June 1st, and 2nd at Washington Fair Park. And you would have to register ahead of time. But we're going to be making that public and advertising starting on next Wednesday.
I have a question.
Go ahead.
You had said that the number of cases were declining, but now they're starting to increase.
Correct.
Where would that number have to be before some kind of action would need to be taken to try and bring that number back down?
So that's the challenge. We had a dashboard that had green, yellow, and red with thresholds. Our idea was that if we got to a 10% of positivity rate, so more than 10% of tests done were positive, we were going to phase down and reduce the mixing through orders. But we are no longer, because of the Supreme Court ruling, our attorneys and the Wisconsin Counties Association attorneys feel that the health department no longer has the authority to write orders or enforce them. So there's literally nothing we can do.
So if the numbers start to increase, there's really nothing we can do other than to try to educate people on to keep social distancing and use our blueprint.
Correct. And I would imagine, I mean, we're anticipating a significant increase, 5 days from yesterday.
I think then, we can, I don't know how all of you feel, but this is I'm incredibly angry about this. And I feel if no one is really listening to the science behind what's going on here. We're not following the AIE directives. We're not following what the CDC recommends. And so I think our next step is proactively because it's going to go up. I mean, there's been nothing that's been done. There's no vaccine. There's no treatment right now. there's been nothing that's been done that is besides social distancing and washing your hands and good hygiene. I think that we're all foolish to believe that this is just going to go away. It's not. Historically, epidemiologically, I think what we need to really focus our.
But don't you think it will go away at some point? Because the Spanish flu did.
The Spanish flu went away 2 years later.
Yeah.
2 years.
Oh, it took 2 years?
Yep.
And the amount of people that died, and it wasn't just the old and the people that had a pre-existing existence. It killed everybody. It killed children. It killed.
Yeah, the Spanish flu did.
Yes, yeah. I mean, we're very, I don't know if you want to call the word fortunate, but this is a very discriminatory virus as we know it right now. But I think the scary thing about it is we don't know it very well. And it could be evolving. There's so many factors that pull into this. I think we need to look at and really kind of focus our efforts into what are we going to do when this does bump up? Because, and I'm usually a very optimistic person, but I mean, does anyone want to jump in here? Do you think I'm crazy? I just don't.
Kathy, I mean, from the health department's perspective, we agree with you. Yesterday was very disheartening recognizing that we have no power. I think we all thought at the local level that the Supreme Court was going to come back with the ruling that said that the state had overreached in terms of what was included in the Safe Rec Home, but that control was going to be given to locals, and that we could draft guidance, or we could draft orders that would allow for some restrictions, what we thought appropriate for our communities, and give us the latitude to sort of move through those phases that we had laid out. But all that control has been taken away from us. As of last night, the state DHS has promulgated a rule, which is what the Supreme Court asked them to do, but that could take weeks to come to life if it even gets passed by the legislature. Mm-hmm. I agree with you. This is not going away. I am fearful of the situation for our healthcare systems, and for, frankly, the health department. We have more capacity than pretty much every other health department in the state to do contact tracing and follow up on positives. But if we get to a place where there's over 100 a day, even with 56 contact tracers, I'm not sure we can handle that. And we can handle it for a few days, but we will be quickly overwhelmed.
So, Kirsten, what are your thoughts on moving forward? I mean, all of this has happened. We can't change it. I don't know why people aren't listening to what the recommendations are. I understand that many people don't have a good grasp on how pandemics work. But where do we move forward? To me, I just feel like the worst is yet to come. And because everyone's going to be so happy that, oh yeah, I can go down to the bar and have a drink, and I can go out to dinner, and I can go get my hair finally. It's going to happen. And I mean, even now, when I go to my local grocery store, not all of the people, the staff themselves even wear masks. I would say, on a good day, maybe 50% have masks on. Where do we go from here?
I think one of the things we really need to promote throughout the community is to make sure that we maintain the CDC recommendations with social distancing and with our hygiene. I think that'll go a long way to keeping people, I mean, for the most part in our communities, people are intelligent enough to understand that there is a risk that this disease poses, and they need to maintain. I mean, we can't go back to just be normal. I mean, we can't go back to shaking hands and hugging people, I mean, but we need to be able to incorporate all those CDC recommendations and those protocols. And, this is streaming, so this is going to be seen by a lot of people, hopefully. And we just need to emphasize how important it is to maintain those standards. You know, for far too long, we've been too cavalier with our hygiene, with our washing of our hands, and touching things, touching our faces. It's something that people need to think about and incorporate into their life going forward.
I think you're going to have people that agree with you, Don, and then I think there are others who are completely feel this is a hoax and there's no common sense to it, and I need my freedoms, and they're going to do what they want to do. And this is just, I don't know, there's no solution here.
Right.
No, I agree. I think we've already seen the last couple of days, as we're seeing the pictures of what's happening in the local taverns. People are not social distancing.
Exactly.
So, I mean, all we can do, it seems the only thing we can do now is to keep telling them you need to do
Education.
these things. Education is the only thing we
Education.
have.
Mhm.
It's a hard battle, and our government says, okay, it's okay now, we can, we can go back. I mean, we can open up and we can go back, because I feel like we're on two really polarized end of the spectrum. And I think education is fine, and I think it's very important, but we have been educating. I don't know how, I'm so happy to see on television, there's a lot of, advertisements that include, please wash your hands, please wear a mask, please social distance. I mean, you can't open up the news feed every single day without information about that. I don't know, when we say we need to educate, I think we have. I don't know of any other mechanism besides, just really thinking outside of the box. I don't know if we have the money to do it. Can we send letters to the citizens of Ozaki and Washington County that explain that this, just because we're opening up things doesn't mean we can relax the recommendations of wearing a mask and washing our hands and staying 6 feet apart, which, I don't know how you go to a bar and have a drink without a mask on. You put a straw underneath your mask. I don't know. It just isn't intuitive at all. I think one message is saying, okay, we can open up now. And that's a message that a lot of people perceive as, oh, it's okay.
I think though a lot of people are really cautious still, and there's a lot of businesses that are still cautious. I think we're thinking everyone's opening, but they're not. A lot of businesses are still watching the CDC things or watching the blueprint from the health department. I know they are because I've talked to a couple of them, and they're still cautious. I mean, so I don't think everybody's jumping into this, but I think education is part of it. And I think people were living in so much fear, they don't want to live in that fear, so they go out, and see. But I don't think everyone's jumping back in the race. Maybe some of the bars or whatever, the young people more than anyone, I think. But education is all we have.
Yeah, I would agree. I mean, as owning 2 restaurants myself, like I'm watching everything, we understand people want us to open, and the plan is we're going to open, but it's like we want to do it the right way. So it's like, we've talked extensively the last several days with my staff, measuring everything out. How can we open safely for our staff and also guests? Because realistically, there isn't going to be a vaccine for a long time, and we can't not go anywhere for a year. So it's how can we open safely and do it responsibly? And I think that's where the education needs to come, and it needs to almost come from my opinion, it's like on the business owners. Like it's my responsibility to do that and educate, my customers, like why, we're only going to be opening with like, super limited capacity, like, reservations only. It's not going to be a free for all at all. But it's, and I don't know, I'm not sure, Kirsten, if there's anything from like the health department that, if there's a hotline or something where, we can send out our local, person that comes and checks and everything and kind of can verify or give suggestions, because, I would assume there's a lot of businesses that are opening that do want to do the right thing, and they might not know, what is the right thing?
So we do have on our website the FAQ, which has guidance for restaurants and recommendations, and they're purely recommendations and guidance. WEDC also came out, the Wisconsin Economic Development
Right.
Corporation came out with guidance for restaurants and businesses on how to reopen safely. I can say that through contact tracing, and we've been doing this since the beginning of April, if there's a situation where a business, be it a restaurant, manufacturing, any kind of business, has an outbreak associated with them. So this is where we do still have some power, we think, per our attorneys. If they have an outbreak associated with them, we will work closely to help resolve the outbreak, but they will be listed on our website as an outbreak. And if it's severe enough, we have the power to close them and require them to be closed for a number of days so they can clean and so that their staff can get better. We've never exercised that power before, but it's truly the only power we have left. I think it will be a tool we can use to help control some of this. Saying you can open now does not mean you can open now safely with no restrictions. And like you said, the burden lies on the business owner, but there could potentially be repercussions if you aren't careful. Like I said, and my biggest fear in opening is not only the healthcare system's ability to respond, the health department's ability to respond, but the worst thing that could happen is we have an economic downturn because there are so many outbreaks and people are fearful, and that could last for a really long time, that we have these rolling closures of businesses. People are already fearful. What happens if this goes on for 6 months and we have outbreaks like what we're seeing in Brown County, but they're associated with restaurants and retail? And what does that look like? I think that's a very real, that could very well happen in the scenario we're facing right now. So it is on the business owners to be responsible and to think critically about how they can open safely.
And I think there are some that are being responsible. I was on a call yesterday with our Ozaki Economic Development Board, and it's made up of a lot of manufacturers and other business people. And I know, Kirsten, you did do a forum with them a couple of weeks ago, right? About 200 people showed up for that. They are asking for that again, and even more so now that they really are seriously talking about opening up. And I'm hoping that we can get something like that scheduled and open it up to possibly both counties to have a Q&A with the businesses who want to open up and want to do it the right way.
It's a good idea.
That's a very good idea.
And it went really well when we did it. And we are more than willing to do it again. Absolutely. We're here. That's the other piece. I think people need to know we're here as a resource. Our greatest asset, I think, is that we have the credibility and the integrity at this point to provide good information. And we have the best interest of our community in mind, period. That's what's most important to us. So we want to work closely with everyone as this unfolds.
And I think that's the message we need to get out there, that you are the reliable source.
Right.
The health department is.
Okay, any more on the situational update, Kirsten?
I think that's everything.
Okay, what did you want to do with the blueprint and frequently asked questions?
I was just going to talk through them. So they're in your agenda packet. And so the blueprint was last updated on May 4th. It was based on research done by AEI. We actually wrote it before the Badger Bounce Back Plan came out. We wrote it because we started thinking about what's this going to look like when we reopen and how do we do it safely, and is there a framework we can apply, which is where that document came from. It is in your packet. Last night we decided to take it off of the website because it's not really relevant anymore, since there are no phases. That everything can be open legally. So it's been removed, but if anyone's interested, we do still have it, obviously. We are willing to share it, but it's sort of just a background on what we were thinking about and internally, and how we feel we should approach reopening. So the actual blueprint is no longer available online. After we wrote the blueprint, we felt we needed to write an FAQ that was guidance for businesses. That is a 50-page document. It was last updated last night. It is written as guidance. It's not all inclusive, and it changes frequently as we learn more. We add more information to it. But it is there specifically for businesses in Washington and Ozaukee County with guidance that we feel from the health department is most prudent to reopen. The other piece that I think is really important for people to understand and for them to know what we've been thinking about is after we started looking at guidance, there was very little information other than from WMC about risk assessment and how do you assign or assess risk of a business as a business owner. And then take that risk and make it actionable. So do things that you can do things specifically for your business that will help you to reopen. When we came across this mitigation strategy hierarchy, it's on page 4 of the FAQ. But I think it's really helpful when thinking about how you reopen a business, any organization, restaurant, otherwise. So it's in an inverse triangle, and on the top says physical distancing. So that's most important to assure that you can continue to physically distance. And if you think about, I'm going to use Costco as the example for all of these. So Costco only is allowing a number of people in their business because they're making sure that people can still physically distance. And when you stand in line at Costco, they literally have a dot on the floor. That's where you stand. So that they've engineered the physical distance, which is the next level. So engineering controls, how do you physically alter the environment to allow for physical distancing and to mitigate the risk of spread? So for example, plexiglass between checkouts and patrons, that would be considered an engineering control. And then administrative controls are how do you reduce the spread between individuals by redistributing responsibilities? So an example of this would be telework. Anyone who can work from home should continue to work from home. And then finally, the PPE. So people should wear PPE when they're out in public. But I think this is helpful for businesses to think through as they reopen, like how can they implement something in each one of these categories to keep people safe. And then the other piece about risk assessment, which is also in the FAQ, is when you think about risk, what's the likelihood of increased transmission in your space, your business, and what's the consequence of that transmission. So when you think about those things, like a large festival, the likelihood of increased transmission is high, and it's highly likely that there's going to be a large number of people, which would have a significant consequence. So a festival is extremely high risk and a high risk activity. So we outline that very specifically. We don't we have guidance in the FAQ for specific businesses, whether or not they're high risk or not, but it's an exercise that we encourage everyone to go through when they're thinking about their own situation, their own company, where they work, HR to think about as they reopen and bring people back into their place of business. We just thought it would be, we need everyone to have all the tools available to them to make the best decisions for them. And we thought that would be helpful. So that is the FAQ. And like I said, it's available online. It's updated frequently. As Kathy mentioned, we did a session with businesses. We are welcome. We would love to do another one. We met with all long-term care facilities yesterday, walked through some guidelines for them. Like I said, I think from our perspective, we really want to serve as a resource for everyone.
Kristen, have you done something like that in Washington County too?
Yes, it actually was for both.
Oh, all right.
Yep.
Okay.
Yeah. Yes, we have. And I think on the long-term care facility call yesterday, we had 70 or plus long-term care facilities on it, and that we've been meeting with them every other week. Actually, we've met with them the last 2 weeks in a row, but again, we want to serve as a resource and we want to keep our population safe. And for example, long-term care, they're our most vulnerable population. They're in a congregate setting, which is high risk. Again, we're trying to put our efforts and energy where we really feel we need to protect specific populations.
Kirsten, 2 things. First of all, I want to applaud the health department. Both of your documents, the one that is no longer applicable and the 50-page document for opening up, are both excellent. They're comprehensive. They're easy to read. I think they cover all the details. I just wanted to thank you and the department for doing such a good job on that.
Thank you. My staff are phenomenal. They deserve all the credit.
Yeah, I think we have one of the best health departments in
Yeah,
around.
I agree.
Sure.
My second question to you is, when you were speaking with long-term facilities, long-term care facilities, do you feel as if they're and I don't know if you could get a feel from, having a lecture with them. Do you feel like they're on board with not letting people in yet?
Absolutely.
Yeah.
So CMS still has a rule standing that nursing home, anyone who's licensed through CMS visitors are prohibited.
Okay.
I think there's a very, and many of you may not even know this. So we issued long-term care facility orders early on. I think the third week of March. I think they came out March 21st, maybe something like that. Because we had the first death in the state in a long-term care facility. It fell on the same day as it was the first death in the state, and it happened to be in a long-term care facility that was experiencing an outbreak. And we recognized quickly the risk. This fell closely on the heels of what happened in Washington State and in Kirkland. So I had done some research, and we wrote orders that were then subsequently replicated in other places. But basically, we limited the number of visitors in long-term care facilities. We limited the number of staff who could work in a long-term care facility, and said that if somebody works at multiple facilities, they should really only work at one, because we know that the staff were the ones bringing the virus into those communities. And then we also required use of PPE, a number of things. So we had written those orders early in March or mid-March. We got a lot of flack for them, but at the end of the day, I think all of our long-term care facilities did their best to implement them, which was the goal. The intention of those orders was that they take them and use them to create, facilities take those orders and use them to create their own policies to implement to protect their residents. They were after the sort of fallout of that initial sort of shock that they were being asked to do all this. I know they're appreciative of it, and they are now fearful that since our orders no longer stand, that they're going to be pushed on harder to open up, and they don't want to, so they want to protect their residents. And if you look at our outbreaks, we do have long-term care facility outbreaks throughout both counties, but they've been well controlled, I think, because of our contact tracing, our ability to get people tested quickly, because we've been working with long-term care, so they've been isolating cases quickly, assigning specific staff to those individuals, doing everything they can since the very beginning to slow this down and stop. So they've been incredible partners. But I do think they're fearful that with these loosening restrictions and our orders now being guidance, that they have significantly increased risk of virus being introduced. And once it is introduced to those populations, it's devastating.
Yes. So just in summation, so that I understand. So as it stands now, Tony Evers is no longer in charge of making decisions about opening the state up, and that it falls really within our municipalities, and that falls within specific owners and whether or not they want to follow the recommendations. And and please correct me if I'm wrong, the only power that the health department has at this point that you know of is if you contact tracing and you find that there's an increased number of individuals that are testing positive from a certain, let's say, business, restaurant, nursing home, whatever it is, then you'd still have the power to shut them down. Is that correct?
Correct.
Okay. So that's really, it looks like it's right now under the discretion of businesses what they want to do.
Right.
And individuals.
And individuals.
We've always had our own power over decisions that we make.
Right.
I mean, really up to, that's changed. I mean,
and that's where our FAQ and the long-term care facility, the FAQ guidance, if you read it, it says, and the version you have in your packet is outdated, really quite outdated, actually. It's, I think, changed 3 times since that got sent. But again, it's an effort on our end to give people what we think needs to happen and what the best practice would be at this point in time.
Kirsten, can you send the most updated one?
Sure. It's also on
Yeah.
our website. You just click on the link.
Oh,
But
okay,
yes, we can send it out after the meeting.
Okay, thank you.
And keep in mind, the other avenue here is the declaration of the public health emergency can be continued. It just needed to be continued in conjunction with the legislature.
Right.
So I know that I've, heard from a number of people that now the governor and the legislature are trying to work together to figure out if they can, agree on a way to open things up. So I don't think it's, while right now, as of today, it may seem like a bit of a free-for-all. My understanding is that the state leaders are now working together to see if there's some measured plan that they can agree upon.
And how long do you think that will take?
Very good question. Don't know.
I think that's the challenge. So they're promulgating a rule, but they hadn't done it until yesterday, and it takes weeks, in theory, to get that done.
Yeah. I saw in the news last night briefly that, of course, Wisconsin made national news. And I saw that there was a reporter standing in Waukesha. Did anybody else see this? I think it was on the 8th. And she was talking about, and she was standing there, and there were people behind her going into bars. And she made the comment of how it was very interesting because, of course, her perception was, Waukesha was totally opened up, and yet you could cross the border into Milwaukee, and things were still closed in Milwaukee. And I think it just demonstrated the uncertainty and chaos that's right now. I found it very interesting. She made this. She spun this. Did anyone see the story?
No.
No. She kind of made a spin that indirectly that it was really going to be up to the different counties as what she was saying. And I thought, so we're going to go back to, we can't go to the health department anymore because that's no longer, within the law, according to the Supreme Court. So do we go to the mayors of the different towns? I don't know. It was very confusing to me. And this
So
is
I'm going to ask Ethan Hollenberger. He's our sort of policy person in Washington County. I know he's on the line. He opened up the call, but I'm going to ask him to weigh in. He understands the rulemaking process better than I do. So Ethan, do you want to speak to it quickly, please?
He may not be on right now. One of the things that I think we're kind of on an island right now, as Washington and Ozaukee counties. We're not going to get any. we're not going to get any guidance from the state in any real time. The governor has met with legislators. He has asked them to produce a Republican plan, and then there's going to produce a Democrat plan, and they're going to try to work together to do that rather than just beginning with a bipartisan plan to begin with. So it's going to take some time. I think it would be extremely helpful if we would endorse the blueprint and the frequently asked questions and urge our residents and businesses to adhere to the guidance. If we would make that into an actual motion and put that in place, and I would be willing to entertain that.
I thought the blueprint was basically non-existent right now.
Well, it's still part and parcel to the plan. Would that be correct, Kirsten, or is that to be disregarded now?
I mean, it's the underlying sort of philosophy and theory behind the plan.
Mm-hmm.
I mean, it still exists.
Yeah, so I think it would go a long way if we would if the health department would make a motion to endorse that plan and to encourage the residents to adhere to it.
Okay, but
Is that the
just so I
50-page
understand
plan you're
this,
talking about?
So that people know that it's important enough that the health department has endorsed this. It's a formality rather than just us talking about it and saying it's a really good plan. It's the health department is actually endorsing that and the guidance that goes along with it.
So you're
So
talking,
you're talking about this
I'm
board,
sorry, the health board, yes.
this board, that's what you want to say, that
Right,
the board is in
correct.
favor of
correct.
this. Yeah.
Yes,
So are
the
you
Board of-
Mr. Chairman,
is it the
Mr.
blueprint
Chairman,
or the
Go ahead.
50 page?
Yeah.
Which one is it?
Mr. Chairman.
Go ahead, Jason.
Hi, everybody. This is Jason, County Administrator here in Ozaki. Just trying to add a little, hopefully add a little bit of clarity here. From what I understand from the Counties Association, they're going to have some legal guidance for counties to look at different avenues in terms of ordinances and things that could be put in place that will allow us, Washington, Ozaki County, and all Wisconsin counties to properly equip ourselves to not only advise, but also potentially enforce orders at the local level. I'm hopeful that will come out in short order, and maybe that might be the, that to me, that's a more direct, A to B approach to thinking about how our health, how we can equip our health department to deal with issues that come up, surgically at different businesses, in different situations. I think right now as we understand, there's limited ability to think countywide because of the Supreme Court decision. I personally, I'd hope that they provide us some clarity. I think they did the opposite in this case. Whether that was I don't necessarily believe it was an intentional thing, but it was in response to the legal questions that were before them. So from what I understand from being on a webinar with the Counties Association yesterday, they're going to work hard on getting that information out to counties so that we can take proper steps to be prepared to do the next steps as we deal with what comes as things open up. So maybe that might be something that the board may consider, as early as next week if we have some guidance from the County Association on how to proceed. So that's what I understand in terms of the legalities and the enforcement that is required for local health orders post Supreme Court decision.
Okay.
So
yeah.
then, Jason, that comes through the county board. The county board would pass an ordinance. Is that what you're saying?
Their recommendation is yes, that in order to pass wide-ranging health orders, there would have to be some sort of ordinance in place that make things enforceable, because ordinance or health orders by themselves are not enforceable.
Mhm.
Ordinances are. So
Okay.
they're working on that now. There was a call yesterday at 4 o'clock, kind of going through the Supreme Court decision, which in itself was an intricate decision. I think it was a lengthy decision with 3 or 4 concurrences and 3 or 4 dissents. So many legal things going on in there. And while I understand some of the statutory things, I'm certainly not an attorney or a person that's even equipped to digest a multi-layered Supreme Court decision. So we anticipate that they'll give us some guidance. I know all counties are looking for that. I know some of the counties in Wisconsin, Kenosha County last night rescinded their countywide order. They initially had put one in place, and then they went back, and after reviewing some of the opinion and some of the legal advice put forward by the Counties Association, they rescinded that. So we're in a gray area, unfortunately, and I know that doesn't help our public health folks deal with the public health challenge that's before us, but I don't know that any branch of state government has done us any favors here in terms of dealing with the public health aspects of this pandemic. So that's what I know as of last night and this morning. So for what it's worth,
Mhm.
I thought I would share with you.
Yeah,
Thank you for indulging me, Mr. Chairman.
Right. I think once the WCA would come up with something, I believe the board could move to endorse that. But until we have actually something, we really can't act upon it. But we do have in front of us a plan moving forward that I believe that the Board of Health should endorse. And it gives it a little bit more teeth for people to want to accept and put into practice those plans. This is a document that probably is the best document that I've ever seen. It's well thought out. It was done before. Kirsten and her team has been working on this. They've been out in front before the feds came out with anything, out before the state came out with anything. I think it would do well for us and for our communities that we serve to endorse this.
Excuse me, just for clarification,
Yeah.
talking about the blueprint for reopening from May 4th or the 50-page Q&A?
It would be both of them.
Both.
Both of
I
them.
like the 50-page one. That's good.
Yeah, I do. I like the 50-page one too. The May 4th one, I think that would need to be updated. It's referring to the Safer at Home Act, which
Right.
obviously is no longer in place.
All right, Kirsten, do you want to chime in on this?
Or I would just suggest that, I mean, so this, again, the blueprint document really is just the framework and sets up why we wrote the guidance that we did.
Right.
I would be comfortable and would really appreciate it if you, as a Board of Health, endorsed the blueprint FAQ, the 50-page document, as best practice, and that you want this to be implemented in our counties in terms as a best practice and guiding document. I think that would be tremendously helpful and supportive.
I would make the motion to do that.
Before we do that, may I add something? I think it's really important on that 52-page document that it is included the AEI recommendations, and let people know that. I think a lot of people don't know about that and don't know that those recommendations have not been met. If you look on page 3, first plan, the short plan, it has the 4 points there that are consistent with AEI recommendations, and it has bolded the 2 out of the 4 that have not been met. And I don't know, I just think it's important that people realize we're not there yet. And I think it gives power to the 52-page document and how important it is that people follow that and really look at those risks and look at, how using the pyramid and how we can do this. Because I just get a feeling that most people, I'm generalizing here, because Supreme Court decision, just feel like, oh, I guess I can just open up and make sure everybody wears PPE or is social distancing. I think it's really important that people understand what these 4 recommendations are and how they are crucial to the stop of COVID-19. Do you see what I'm saying? And I don't know if you can add that to the other document. Does anyone else have any ideas or any opinions about that? Because it's really the crutch of, why we were on the path we were on, and now we've been derailed from that path. And
I believe that the 50-page document is awesome and excellent, and I would totally back that. I really think we're not giving enough credit to our business owners that haven't been open. I really think that they have been doing work behind the scenes that we don't even know about. Just like who's on our board that has those 2 restaurants. I mean, no one wants their patrons to come in and get sick. I know a restaurant that's opening in Hartford and they're waiting till today. They didn't open right away. And they're only seating so many. They're only taking reservations. I mean, another store, a retail store that's opening, they're only doing the 5 or 6 in the store. I mean, and another one's doing the same. I really think if we give them that 50-page document, they're looking for that too, to say, this is what we need to do and show their staff, this is what we need to do. I
agree.
really think that a business that hasn't been open is really going to be very cautious on what they're doing. And people are very cautious in going. But, you know, if you go into the stores at Costco, Target, that have been open and you have, and that's crazy enough. I mean, if you want to see crazy, it's been crazy in there all the time. I mean, I don't know of a time I've gone into any of those stores where it hasn't been hectic. I don't care if there's dots on the floor. People are still coming up to you. I mean, I think our small business owners are more cautious than our big box stores have been.
And I agree with you. I think this 52-page document should definitely be voted on by the board and approved and recommended. But I would just love to see those AEI recommendations on there because they haven't gone away.
But to, be realistically, the 50-page document is a good working guide for businesses and people in both counties. I understand about what you're asking about, Kathy, but I don't think most people, that isn't going to really mean a hill of beans to the ordinary citizen, most of them. It's good information. I'm not disagreeing with that, but I think just the way the 50-page document right now is a good guideline for everybody to follow and look at and understand. It's written easily understandable.
I agree with Chris. I think this 50-page document is really a great example of a living document. It's changing every day to get even better, to help people to do what they need to do to open their businesses and do it in the correct way.
Okay, Josh, you had something to add?
Yeah, I think that if you look at both the press release that came out from Ozaki County yesterday, as well as the one Washington County put out and the proclamation on Washington County side, it's really kind of threading the needle between what both of you are saying. It's endorsing the blueprint for reopening, period. It doesn't address, is it the FAQ? Is it the actual blueprint document? It's the concept that you're really adopting. And if you go to the website, Kirsten's website right now, you can't even find the blueprint document. You just find the FAQ, which is the meat and potatoes of what you're doing. So it's a public policy question of, are you adopting the concept of the blueprint to reopen? And really basically supporting the public health department.
And I think we're all for that.
Yeah.
Yep.
Yeah.
Yes.
Okay,
I didn't mean to make that a question.
Okay, well, we have a motion on the floor to endorse from Doreen. Do I have a second?
A second.
Second from Kathy. Any further discussion on that? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? All right, motion carries, endorsement. Kirsten, we talked about testing and contact tracing. You have more to add?
I don't have anything more to add. I just want to say thank you for endorsing the blueprint. And I also just want to make clear, it is not an order. It is just guidance for our businesses, and it's been endorsed by the Board of Health, which I appreciate greatly.
Great.
Thank you for the good work.
Okay, we really didn't talk much about the budget implications, although we know it's going to be a massive issue. But what do you have on that, Kirsten?
I just wanted to give everyone an update on where we stand in terms of budget internally, and just this is only applicable to the health department. I mean, this has had much greater implications, obviously, on our economy widely at both a macro and micro level. But for the health department, as of last Friday, we had spent around $750,000 on our response. So that includes staff time, the purchase of PPE, the requirement for additional electronics so we can work virtually, hiring temporary contact tracers, overtime. All of the things that we've spent money on has been like I said, last Friday, around $750,000. So, and we have not yet seen any money from the state or from the federal government to support this work. So I just think you need to be aware of that. I think a request from me and from my budget manager is, and we as health officers across the state have put pressure on the state, on DHS and DPH to release our funding, but it's not been clear how much we're going to get and when we're going to get it. And we are on the ground doing the work and have yet to have seen anything. So I just thought you should be aware as the Board of Health, that's where we stand.
Is there anything we can do? We need to contact.
Well, the monies are funneled through the state and the state allocates.
Correct.
So your state representatives, governor would be people to contact.
It would be great if you could draft a letter as a Board of Health and send it to DPH or DHS as well, just stating that, we're on the ground doing the work and haven't seen funding, and it needs to be sent to the locals who are doing the heavy lifting.
I would, yeah.
Could you provide that for us, Kirsten? And we'd be more than glad to sign it.
Absolutely.
Okay. Did you want to go into your annual report?
Sure, which seems like this was a lifetime ago. So in your packet also is our annual report from 2019. I don't know if you have any questions about it. I was only here for part of 2019, and it just basically represents the work that we did last year. And I can't imagine what the 2020 annual report is going to look like. It's going to be quite different. There'll be a whole new section.
Yeah.
Okay, any questions on the annual report from board members?
I'd just like to thank the health department for including the Ozaki Washington Coalition on Sexual Health and recognizing that is an organization supported by the health department. And so I'm glad that was added. I think that was new. And I'm also hopeful that in the future, when we're looking at I think it's on, I'm scrolling to find it. I think it's on page 1, when it highlights the actions of the health of our community. Hang on, I'm almost there. Here. Nope, that's not it. Okay, here we go. On page, it's not paginated. It's the first page of besides the index, where it has the Ozaki Public Health Department visions and missions, and it has Essential 1. And when it has outcomes, the health indicators are adult smokers, obese adults, excessive drinking, and poor mental health days, which are really good benchmarks for the health of our community. At some point, and maybe not next year, but in the future, I think we also need to include contagious diseases on there.
Mm.
Great, thank you for the recommendation.
And
you should also know that at the end of last year, we had gone through a vision and mission exercise. So it was going to be changed, but that work has stopped temporarily.
That went somewhere else.
Yes. So, but it is in the process of being updated.
Right. Thank you. It looks like a good report to me.
Mm-hmm.
On our Kirsten, are we going to add the COVID-19 onto our communicable disease reports going forward or not?
We certainly could, or we could just pull it out as a status update.
Okay.
For the immediate future, I would imagine.
They're talking of being around for 2 years or something,
Right.
Maybe something that we should be tracking for.
Yeah, I do think it will be added. So this report is actually generated from a system that it's not in there yet, and I would imagine it will be.
Okay.
Yeah. Yeah, but I would imagine it'll be here moving forward.
Okay.
Okay. Okay, any more on the annual report? Okay, thanks, Kirsten. You've, I can't even imagine how much work you've been doing, but your team you guys are awesome.
Thank
Yeah.
you.
We are very lucky in Washington, Ozaukee County to have
Yes,
the
we
health
are.
department we have.
I agree.
I think we have the best health department in the nation, so.
Mhm.
Thank you. I feel that
I
way
do
too.
too.
My staff are phenomenal.
Yeah, you guys are awesome.
So next meeting date, I have a request from, I'm in the process of filling vacancies in committees, including the Board of Health. And I have a new supervisor that she's in the public health field already. She's an administrative nurse
I'm in a
for the
meeting.
VA. And her request would be that if we could move meetings to the afternoons. If that would work for people, that would be much easier for her to actually attend. So
What day of the week?
could be the same day.
Yeah, I can't do the
Friday?
afternoon on Fridays.
Okay.
I can do Monday, Wednesdays.
What does the board feel like on this? Are there any other?
Can't do afternoons.
Monday and
I think
Wednesday work for me.
Friday afternoons, I think, would really be hard for people.
Yeah, Friday afternoons would be tough. I understand that. Yeah.
Monday afternoon works for on my point.
Me too.
Me too.
Afternoons are tough for me either, any day.
Any day are tough.
Yeah.
I agree.
We had this problem last year.
Yeah.
Okay, if it's too much of an issue, then that's not a problem. It was a request and I told her I would bring it up. She'd be a great asset to the board, but
Yeah, she is a nurse, correct?
yeah, at the VA. Administratively now she's working on the front lines with the COVID. So they got her out of the office now and actually working in the field. So, but yeah, she'd be a real an asset with all of her. But we'll see what we can do. So it'll remain the same Friday mornings then. Okay.
I mean, with these Zoom meetings are perfect for it.
Yeah.
One has to travel.
Yeah.
We can continue to meet this way if people would like to, just coronavirus or not.
Yeah, I like this. Yeah.
Yeah.
And then you don't worry about a building being open.
Right.
Yeah. You don't have to worry.
We've had those meetings too.
Yeah, I tell you what, a lot of the teleconferencing now, Zooms, people don't realize how much travel time is involved. When you're,
Kirsten, just so you know, legally, we have to have a location for public access, so we can't do complete virtual post-COVID.
All right.
Thanks, Ethan.
Yep. Sorry.
We can still incorporate it though for people that want to use it, correct?
That's correct.
Okay.
So if a board member can't be there in person, they can still use this format.
Right.
That's correct. You just need a physical location so the public can attend.
Okay.
So I'll probably be there and everybody else will be at. Thanks a lot. Okay. What is our next date? What are we
It's
looking
July
at?
17th.
July 17th?
Correct.
Okay.
We'll know a lot by then.
Yes, we will. We will.
Okay.
Unfortunately or fortunately, maybe it'll be positive. I'm hoping it's positive. That's going in the right, that everybody's been out and about and exposed and whatever.
Yeah, and I think too now with some of the antibody testing that's going on, I know Florida's doing 200,000 in the next week or two, should be complete with theirs, and that'll give us a better idea of what the community spread is. So I think that's the one thing that's really lacking in our data. So, okay, seeing we've conducted all our business, we're hereby adjourned. Thank you, everybody, for attending.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.
Hi.
Bye.
Bye. Thank you.
Thank you.